Dr. Karen Dickus is an ophthalmologist for Ophthalmology Limited, and she warns patients of glaucoma.
It's a condition where the eye pressure is too high and it causes damage of the optic nerve. And the optic nerve is what is needed to get the signal from our eye to our brain so that we can see.
Glaucoma can affect all ages, although it's more common in older adults. And Dr. Dickus says once patients have glaucoma, they're stuck with it.
So glaucoma is what we call the silent thief of sight, because you're not going to know anything is wrong until it's too late. And so that's why we really encourage people to go in for yearly eye checks. That's really the best way to detect it.
Dr. Dickus says glaucoma is genetic, and if people have family members with glaucoma, they should be checked.
As a general rule, I think the Academy recommends that have an eye exam once in your 20s, once in your 30s, and then 40s, depending on if anything is seen.
Dr. Dickus says there aren't any lifestyle choices that can raise glaucoma chances. However, she says aerobics, like walking, can help control glaucoma pressure.
We know that aerobic exercise is good for people that have glaucoma. If they are consistent with it, it can help keep their pressures more controlled.
But reducing eye pressure is the first step.
We like to see usually a 20 to 30% reduction in the pressure is a good starting point. And then once we get that reduction, then it's just following that patient over time to see, okay, is that pressure low enough for them, or do they need to be lower? Are they still progressing?
That can be in the form of drops, lasers, or surgery, but she says they're for one goal.
So all the drops and the laser that we do in the office are trying to get that drain to work better. And sometimes at some point that drain just isn't functioning enough and we have to give you a new drain.
And her crew want to help as much as they can, but it's on the patient to come early for checkups.
Patients come to us, we want to be able to help them, but especially if they already have advanced loss when they come to us, we can't get that vision back once it's gone from glaucoma. And I think that's another key point just to remember is prevention is huge with glaucoma, because once it's gone, it's gone.